Sudden weakness on one side of the body, slurred speech, facial drooping, inability to find or understand words, these are symptoms of a stroke. It could be subtle or it could be severe. Regardless, rapid diagnosis and treatment is the key to recovery. Not long ago, not much could have been done for someone if they had a stroke. Often we could only wait and see how the patient recovered. Prevention was the only tool we had to combat strokes. Blood pressure control, aspirin or other blood thinners, cholesterol control, and of course, a healthy diet and exercise remain especially important. Thankfully, today we have a few more options. Clot-busting medications are a great advancement in the treatment of strokes. If diagnosed soon enough, sometimes clot-busting medications can work to break up a clot that was blocking blood flow in an area of the brain and restore circulation. This can help to preserve or at least minimize the area of the brain that was affected. There are risks, such as bleeding, but they may be worth it. To minimize risks, this medication can only be prescribed if certain criteria are met, such as onset of symptoms less than 4.5 hours prior to treatment, age limitations, medical history, blood test results, and exclusion of it being a hemorrhagic stroke. Hemorrhagic strokes are bleeding strokes, when damage is done from a bleed in the brain rather than from a clot in the brain. Typically, a CT scan is needed to make sure a stroke is not a hemorrhagic stroke. Even more recent developments resulted in the ability to manually remove a clot in the brain and restore circulation. Highly specialized, this new procedure seems almost miraculous. Similar to an angioplasty restoring circulation in a blocked artery in the heart, now specialists can insert a catheter into an artery in the arm or groin, advance it up to the clot, and remove it, restoring circulation to the affected area of the brain. Some patients experience a rapid resolution of their symptoms following this new procedure, where before they may never have been expected to regain the function of one side of their body. Now they may be able to walk out of the hospital the next day. The keys are recognition and time. Know the signs and get help quickly. Think of the acronym FAST. Face drooping, arm weakness, speech difficulty, time to call 911.